This video will show you how to properly set up and administer your medication via the CADD Solis pump. Please follow all instructions shown in this video. Administering home medication on the CADD Solis pump can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter dressing change and any labs that your doctor has ordered. If medication is refrigerated, remove from the refrigerator 2 to 3 hours before administering. Place the bag of medication on a clean, dry surface to warm to room temperature. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds and then dry your hands. Use a separate towel to turn the faucet off. Check medication label for name, drug, frequency, and expiration. Inspect the medication bag for any cracks, leaks, particulate matter, and clarity of medication. If you find any abnormalities in your bag or label, contact your pharmacy right away. Gather your IV therapy supplies. This includes your bag or cassette of medication, CADD Solis pump, AA batteries if not using rechargeable batteries, pouch to hold pump and medication, CADD tubing, antiseptic wipes, 2 saline syringes, 1 heparin syringe if ordered, and 1 light blue sterile cap if the tubing will be used for your next dose. CADD tubing should be changed daily for intermittent medications, but only on Monday, Wednesday, and Friday for continuous infusions. Some medications will be hung on an IV pole your home nurse will set up for you, instead of being carried in an ambulatory pump and medication pouch. Prepare a pre-filled syringe of sodium chloride, also known as normal saline, by holding the syringe upright. Remove the cap of the syringe. Gently pull back on the plunger, then gently push forward on the plunger to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Recap the syringe. Repeat for second saline syringe and heparin syringe if your doctor ordered heparin flushing. Most medications will come in a bag, but some may come in a cassette. For training purposes, we will demonstrate using a bag in this video. You will be required to connect the CADD tubing to your medication bag. Remove the blue flow stop device from the tubing cassette by pulling it upward. Remove protective tab from entry port of medication bag. Remove cover from the tubing spike, then insert the spike into the entry port using a pushing, twisting motion. Be careful to not touch the spike. Press the power button on the right side of the pump. The pump will go through an automatic review. The pump will make a series of beeps. The screen will look like this when it is fully powered up. Attach the tubing cassette to the pump by first opening the lever by pulling it down. Next, secure the 2 plastic feet of the cassette around the 2 silver bars, and then push the cassette against the pump using a hinge-like motion. While holding the cassette in place, close the lever by swinging it upward to lock the cassette in place. The pump will briefly display Admin Set Latched. Do not force the latch closed. When the cassette is seated properly into the pump, the latch will easily close. The display will read, Reset Reservoir Volume with the pre-programmed amount of medication. To reset the reservoir volume, press the soft button under Yes on the screen. Resetting the reservoir volume will change the amount of volume to be infused to the pre-programmed prescribed amount of medication. The display will read, Prime Tubing. Press the soft button under the word Yes on the screen. Make sure tubing clamps are open and the pump is turned on its side with the lever side down to assist with removal of air bubbles. Pump screen will read, Disconnect tubing from patient. Open clamps, then press Prime. Press the soft button under Prime on the screen. Some medication will require filtered tubing. If there is a filter on your CADD tubing, it will not change how you administer your IV medication. However, during priming, the tubing filter is to be held upside down with the arrow pointing up to prevent air bubbles in your tubing. When the tubing is fully primed, and you see a drop of liquid in the cap at the end of the tubing, press the soft button under Stop Priming on the screen. The pump will ask you if you would like to continue priming. Press the soft button under the word No on the screen. After a minute, the pump screen will go blank, going into Power Save mode. This is normal. The amber light will continue to blink, indicating the pump is on but not infusing. Scrub the injection cap of your IV catheter with an antiseptic wipe vigorously for 30 seconds. And let air dry for 60 seconds. Flush your IV catheter with the prepared sodium chloride. Push and twist the saline flush syringe onto your IV injection cap. Flush using the push-pause method as instructed by your home nurse. Discard the used syringe. Scrub the injection cap of your IV catheter with a new antiseptic wipe vigorously for 30 seconds. And let air dry for 60 seconds. Remove the protective cap from the end of the IV tubing. Then, attach the CADD tubing to the end of the injection cap with a push and twist motion. Be careful to not touch the tip of the tubing. Press any button on the pump to bring the display screen out of Power Save mode. Press the soft key under Program to review your pre-programmed delivery settings against your product label. Press the down arrow to move through the settings. Press back when complete. If you find any differences in the pump settings and the label, contact your nurse right away. Start the pump by pressing the Start-Stop button. The pump will read, Start the pump. Press the soft button under the word Yes on the screen. A green light at the top of the pump will blink, which indicates the pump is running. The display will read, Running. Review the pump display. The top line will display the remaining reservoir volume. The pump status as running, and the battery charge. Next is the pump mode, the time, and that the pump is locked to prevent settings from being changed. The larger section indicates when your infusion will be complete or when the next dose is to be given for intermittent modes. Shortly after the pump display is running, the pump will go into power save mode. The pump display will go blank, but the green light over the display will continue to blink. The blinking green light is the indication that the pump is running. Remove all trash from the area. Now that your IV medication is infusing, you will place the pump and medication in the ambulatory pouch. Your pouch has a specific compartment on the right side to hold your bag of medication. Open the Velcro straps of fabric and place your medication bag in the right side of the pouch and secure with the Velcro straps. Thread the securement belt through the hole of the medication bag. Be sure the tubing is not kinked at the bottom of the bag. The CADD Solis pump will be stored on the left side of the pouch. Slide your pump with the pocket screen side down and secure with a Velcro strap as shown. Tubing from the pump to the patient should be threaded out of the pouch at the zipper opening. The pouch can then be zipped closed and carried with you as you move around your home or community. Always keep your medication pouch near you while it is infusing. You can check on the pump by opening the flap on the pouch to confirm it's running properly. When your infusion is complete, the pump will alarm and read, "Reservoir volume is 0, pump stopped." Press the soft key under the word "Acknowledge" on the screen to silence the pump. You will begin stopping your medication by preparing your work surface. Clean the area thoroughly with soap and water or a disinfectant wipe. And drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds and then dry your hands. Use a separate towel to turn the faucet off. Gather antiseptic wipes, saline syringe and heparin syringe for flushing, and any other supplies as directed. Remove the pump and medication bag from the pouch. Turn the pump off by pressing the power button on the right side of the pump. The pump will read power down. Press the soft button underneath yes. Disconnect the tubing from your IV catheter. If another dose of medication is to be administered the same day, place a blue protective cap on the end of the tubing to keep it sterile. Be careful to not touch the tip of the IV tubing. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse using a push-pause method. Disconnect the syringe. If your catheter requires the use of heparin, scrub the hub of your injection cap again with a new antiseptic wipe for 30 seconds. And allow to dry for 60 seconds. Attach the pre-filled heparin syringe to your injection cap and flush the IV catheter using the push-pause method. Disconnect the heparin syringe. Open the lever to remove the CADD tubing from the pump. Gently push the lever to a 90-degree angle and then push a bit further to disengage the tubing from the pump. If this is your last infusion for the day, discard the tubing and medication bag. If not, set aside with the blue cap on the tubing to keep the tubing sterile for use. If your infusion is continuous, you are required to change your bag of medication daily, but your tubing will only be changed on Monday, Wednesday, and Friday. You will need to follow these instructions to change your medication bag only. Your pump will be running. Press the Stop-Start button. Your pump will read, "Stop the pump." Press the soft button under the word "Yes" on the screen. Remove the protective tab from the entry port of the new medication bag. Remove the spike from your current medication bag. Insert the tubing spike into the new medication bag using a pushing and twisting motion. Do not touch the spike. Press the soft button under the word Tasks on the screen. Reset Reservoir Volume should already be highlighted. Press the Select button on the keypad. The pump will read, "Reset Reservoir Volume to the preset volume." Press the soft button under the word "Yes" on the screen. Press Stop-Start button to start the pump. The pump will read, "Start Pump." Press the soft button under the word "Yes" on the screen. If you are provided with a rechargeable battery, the pump must be plugged into an electrical outlet for a minimum of 4 hours each day. It is recommended to either plug in the pump while the battery is not in use or overnight while you are sleeping. The AC power cord must first be plugged into the AC power adapter. Next, plug the AC adapter into the pump's AC power jack on the left side of the pump labeled 7V. You must plug the connector firmly into the power jack and confirm a proper connection indicated by the blue light next to the power jack. Failure to push the AC adapter all the way into the power jack may result in intermittent connection or power failure. The rechargeable battery should be used, charged, and stored in a temperature above 50 degrees Fahrenheit to prevent power loss. The pump should be in the off mode to change or install AA batteries. You will know it is time to change your AA batteries when the battery indicator on the pump screen turns yellow for low battery or red for depleted battery. The CADD Solis pump must be stopped and powered down before changing batteries. You will need to push the Start-Stop button to stop your infusion and press the soft key under the word Yes on the screen when the pump reads Stop Pump. Next, you will need to press the power button on the right side of the pump and press the soft key under the word Yes on the screen when the pump reads Power Down. Open the battery door by turning the knob counterclockwise to release the latch and remove depleted AA batteries. These can be disposed. Replace the AA batteries with new batteries by following the diagram inside of the pump. Close the battery door and turn the knob clockwise to secure it shut. Press the power button on the right side of the pump to turn the pump back on. If you are changing the supplies, this would include your medication bag or tubing. Follow the previous instructions. If you are not changing the bag, press the Start-Stop button, then press the soft key under the word Yes on the screen when the pump reads Start Pump. All CADD Solis IV supplies are single-use only and should be disposed of after one use. All home IV supplies are to be double-bagged and disposed of in your household garbage. Proper administration of your IV medication at home is important for your safety. In the event of an emergency, always call 911.